Well, you know, when I first came up here, I wasn't really sure what to expect. I knew Mena was in the western part of Arkansas in a real small town, and I was living in Stuttgart at the time. So I drove up here and stopped in Hot Springs, and after about another 30 or 45 minutes, pulled over to a filling station and got out and looked around, and I thought, wow, this is unbelievable. And then I came up and found the hospital and came in and met everyone and got that warm feeling, a feeling of you know, everybody's just wants to talk and very friendly, warm feeling. And I had a little break in the interview process, and I was told to take a drive up one of the local roads here to Queen Wilhelmina. And I thought, well, I guess I'll do that. And I got about halfway up there, and I pulled over and got out of the car and looked around. It's the most breathtaking view I've ever seen.
My wife and I used to enjoy coming up to this part of Arkansas, to the Ouachita Mountains, just to get away from the hustle and bustle of things. So we were familiar with the area already, coming up to get a cabin and canoe and hike and just enjoy the outdoor activities. So when I heard about the Mena Regional Health System looking for a CEO and was contacted about that, I said, you know, we pay to go up there on vacation. It'd be nice to maybe get paid to live there. And so we moved up about 2.5 years ago, and it's a wonderful place to be. Great balance between family and personal activities and work environment. Mena Regional Health System is a team of healthcare professionals who focus on individualized care, seeking to exceed the needs and expectations of our patients and make a difference in every life that we touch.
You know, there's definitely a team approach here in rural medicine. When we have a bad patient come in, you know, people don't separate, well, this is a cardiac issue, or this is a pulmonary issue, or this is a vascular issue. We all come together as a team approach, and each shares some responsibility in taking care of the patient, and it's an exciting thing because it brings us all closer together, and we all learn from that experience.
Mena Regional Health System operates 65 beds that include 12 beds for geriatric psych, 12 beds for rehab, 6 ICU, plus women's beds designated for women's services, as well as med-surg. We run an average daily census of about 26. In our emergency room, we see consistently about 900 patients per month in the emergency room. This particular facility that we're in, the newest part of it, is only 5 years old. The earlier part was built in 1985, but a new addition that's about 50% of the facility is new in 2005. Mena has a population of about 6,000, but our draw area is about 45,000 people. We are a hub for western Arkansas and eastern Oklahoma. In fact, recent study shows that right at 50% of our patients come from outside of Mena.
We have no problem with lack of patients. It's very busy. It's very, very busy, and there's a lot of people from the outlying areas end up coming here, you know, when there's a problem. One of the good things about being here is that we have a good working relationship with doctors in Hot Springs and Fort Smith. And if we send a patient over there, they'll generally send them back for us to do the care after surgery, or if they have a special procedure done, such as a cardiac cath or any type of cardiac surgery. So the good thing about it is people here, they want to come back to the doctors here, and they realize our limitations as far as specialty procedures. So they're fully okay going to get a special operation done or a special procedure done. And the good thing about it is the doctors, we have such a good relationship with them. They'll send all the patients back to us, and then we have our hands full again. But I think one of the things that would draw me to this area, that drew me here, is the people, number one, the closeness of the community, the beauty of the area, the ability to practice general surgery like I was trained to do, and to be able to do a wide variety of procedures. which I enjoy the challenge of. And working with the physicians here is just wonderful. I think the thing that I'm most proud of is obviously, taking care of people. The quality of care we can provide here. I think we do an excellent job in patient care here. We have a good reputation in the community. We do good work. The nurses, the nursing staff, the administration, every department in this hospital is as solid as any hospital I've ever worked at. And that, to me, I didn't expect. I expected a lot less, but I can't compare any hospital to this. And I've worked in city hospitals. I've worked in different areas, but the quality of care we provide is key for me, and the ability to do good surgery, to have good outcomes, to see these patients in town a couple of weeks later and they're smiling, that's the key.
Mena Regional Health System is financially sound. Our finances are solid compared to other hospitals in general, urban or rural. Mena Regional Health System is sound. We have money in the bank. We have the capital for growth and development. We continue to add services. Right now, today, as we speak, we have a new 64-slice CT scanner that will be delivered next month and installed. We have a brand new 1.5 Tesla Toshiba MRI that will be delivered by the end of this year. This hospital is well capitalized with equipment throughout the hospital. We're progressive and stay current on capital and technology to meet the needs of our physicians and our community.